We've heard about hydroxychloroquine. I think the standard mainstream government response is it's not viable. Don't think about it, don't use it. And of course, we've seen our own President Trump say recently he's on it. I talked to Dr. Judy Mikovits last night. She's like, I got some right here. It has been shown as a potential to prematurely prevent, certain infections. How do you feel about the exploration, or at least the consideration of that drug? And I'm curious what the panel thinks as well, and maybe other drugs.
Well, let's look at it from a common sense standpoint. So you got hydroxychloroquine and Zithromax, both drugs. Zithromax is a macrolide. That class of drugs has been around for, 70, 80, 90 years. Zithromax may have been only on the market for 20, 30 years, but that class of drugs has been around for many years, erythromycin type drugs. And then hydroxychloroquine has been used for treating malaria for at least 50 years or longer. So now you've got these two medications that are tried, tested. We know the safety profile, and we know it's working and it's effective, and nobody's died that's been on that's had COVID-19 that has been treated with that. We've got multiple doctors that have used it and in their patient populations with hundreds of patients and had great success. Now, the question should be, why are they questioning that and wanting to bring in hundreds of millions of dollars of research to create a vaccine that's never been tested in animals? And we know how long it takes to make a vaccine. And with Bill Gates saying that we know that 700,000 people or more are going to die, which is going to be a lot more than that if they get the vaccine. Why would you say, no, don't use something that's safe, proven, and it's been used for 70 years, but let's throw god-awful amounts of money towards this vaccine that's never been proven in a new class that has never been shown to have any efficacy, and in a patient population that we don't know what's going on, but we see that it's a hypoxic injury. We see it's an altitude sickness type of issue. We see that it's a histotoxic hypoxic injury, which no vaccine is going to work for. So let's go ahead and do that, but let's not do the thing that we've seen to work. To me, if a person says, I want to get the vaccine, I say, let them take the vaccine. They need to be eliminated from the genetic pool, because I'm being very facetious here, but that's just idiocy. How could anybody justify doing something that we know is safe and we know getting results? Dr. Fauci clearly said that should not be done. It's anecdotal. We don't really know if it works. Yet he has a vested financial interest in the vaccine. But take this vaccine that's experimental, that's new, that nobody's ever tried before. But yeah, you should take that. But don't do something that we know is safe and that works.
All right, so let me ask the panel then what the question should be exactly what? Do they believe that we should be prescribing these medications? What is the question?
The question should be, how many people believe that we should be using things that we have seen, observed, monitored, and recorded to have shown a clinical improvement, as opposed to using something that has never been shown to work and that has never been tested in humans and has never even been tested in animals? Should we use something that works? I mean, it's a yes/no question. So should we use something that is known to work without having to resort on experimental vaccines?
Okay, so raise your hand if you believe we should use those things that are tried and tested, such as the things you mentioned, or anything.
Yeah, so hydroxychloroquine, Zithromax, natural things like selenium, zinc, multivitamin, washing your hands, rest, exercise. No, they want you to stay at home, not exercise. It's just idiocy.
Okay, all right, that's all.
Is that like 100%?
Yeah, it's pretty much everyone. Everyone believes that. Okay. Just on that same note, just kind of back to the previous question, how many people on this panel think right now that everyone should just go back to work, get out of their houses, and resume life as normal the way it was in October of last year? Could I just see hands? If you don't, that's fine. Keep your hand down. But if you do, can I just see hands up?
Dr. Christine, we can't see your hand if your hand's up there. There you go. See, she's got her hand up there, right?
Okay, what's this percentage here? I mean, wow, it's a lot of people.
I think it's like 99%. I don't see any no hands.
I mean...
Do you see any no's?
No. I see thumbs up. So a panel of 160 doctors basically said we should all go and resume things as they were 6 months ago, pre-pandemic scare.